What is the difference between a case and an infection? Does a positive PCR case equal an infection? How does a PCR test work? What is it searching for? What is meant by the term cycle threshold? What do studies on cycle thresholds in institutions such as the Public Health Agency of Canada say is the optimal cycle threshold to be used? What is the cycle threshold used in your state or province? What is meant by sensitivity and specificity of a COVID test? How does increasing cycle threshold affect sensitivity and the rate of false positives? What is the difference between a virus and genetic material? What is meant by viral load? What genetic material is the current PCR COVID test searching for? What did the inventor of the PCR test, Kary Mullis, say about using PCR to detect viruses? What did the inventor of the COVID-19 PCR test, Dr. Christian Drosten, say in 2014 about using PCR tests for infections? What did Anthony Fauci say about the COVID PCR test above 35 CT and false positives? What did the CDC quietly publish about false positives and the PCR test? What were the 10 fatal flaws of the Corman-Drosten paper outlined in the Corman-Drosten review and retraction request put forth by 22 highly qualified doctors, say, found on cormandrostenreview.com? What were the 10 fatal flaws? What is the difference between cases and case impacts? How do we determine cases? How do cases compare to case impacts? If no test to determine cases existed, how could we determine infections? What is the difference between symptomatic, pre-symptomatic, and asymptomatic? What do studies say about pre-symptomatic transmission? What do studies say about asymptomatic transmission of SARS-CoV-2? If we consider the concept of viral load and means of transmission, how might that differ between symptomatic, pre-symptomatic, and asymptomatic carriers? According to the data available, what percentage of COVID-19 transmissions, or SARS-CoV-2 transmissions, is a result of pre-symptomatic transmission, of asymptomatic transmission? According to any data showing and comparing different regions' infections over time, have mask mandates prevented the spread of SARS-CoV-2 cases? Case impacts? How does the flu spread according to temperate and tropical climates? What about SARS-CoV-2? Is it similar? How did the death rate after the first wave compare to the death rate in the same time frame around the world from previous years? For example, the first 34 weeks of 2020 versus the first 34 weeks of 2019 or 2018. How did those death rates compare? Using the models created back in March, how many people did they estimate would die with a lockdown and with flattening the curve? How many people actually died? How are they calculating death rates? What are the impacts of the measures taken to flatten the curve? How much have deaths due to diabetes, cancer, heart disease, suicide, overdose, non-COVID related deaths, how much have they increased over the second half of the year? If COVID-19 is extremely contagious and asymptomatic spread is much greater than we think it is, and given that the death counts are inflated, what is the true fatality rate of COVID-19? What are the case impacts of the flu in previous years versus the case impacts of COVID? If I have no symptoms, am I really sick? Has there ever been a successful vaccine for a coronavirus before? Why is it difficult? What is viral interference? What is herd immunity? Why did the World Health Organization on November 13th of 2020 remove the following from their definition of herd immunity? Removed was immunity developed from previous infection. Why did they remove that? What are the risks and probable symptoms for me if I get infected with COVID-19? What are the risks and probable symptoms for me if I get the vaccine? Who is liable if a vaccine makes me ill? Do I have a right to decide what gets put in my body? According to the CDC, Advisory Committee for Immunization Practices paper on COVID-19's first dosage registry, how many people out of the 112,000 vaccine recipients had a health impact event, rendering them unable to live normal daily life, work, and in need of a health care professional? How many people? Why is it that if an old person with multiple comorbidities dies with COVID, it's a COVID death? But if a person with the exact same health profile dies after a vaccine, it's because they had old age and compromised health? Why are many pro-vaccine doctors anti-COVID vaccine? And why do they then get labeled anti-vaxxers? Why are doctors who promote HCQ, budesonide, and ivermectin claiming highly successful results treating COVID, why are they being censored, cancel cultured out, attacked, unjustifiably discredited and silenced, without properly addressing the science? Has the SARS-CoV-2 virus been isolated, unadulterated, from a diseased patient anywhere in the world? That is, without being cultured, amplified genetic material from a PCR test, or from sequencing? Why is there no record of this from any freedom of information by governments around the world? How does the isolation process work? What are Koch's postulates, and do they apply to viruses? Has it been proven that the identified viral material tested for causes disease in the host? What is germ theory? What is terrain theory? If the vast majority, 3/4 of flu infections are asymptomatic, how many people have I killed spreading the flu over the past decade?